What is like one of the number one rules or strategies going forward, in terms of being a healthcare provider?
So this organization called the Center for Healthcare Quality and Payment Reform actually analyzed 600 or analyzed rural hospitals. So they found that 600 were at risk of closing, and the remainders were actually not at risk. And they went through and looked at the financials, and what they determined was that the only difference between a hospital at risk of closing and the rural hospital that isn't at risk is their private pay rates. It gets back to the whole issue is you're underfunded for Medicare and Medicaid. Plus, in addition, now over 50% of a hospital's bad debt is what's called insured bad debt because the payers have changed their plan design to turn providers into debt collectors. And so as a result, the only option you have that the government has left us with is to be a hidden taxer, if you will, of employers. And it's actually good for the employers in the long run because if they don't subsidize underfunded Medicare and Medicaid, then at the end of the day, the services won't be available. So not only does this apply to rural hospitals, it applies to all hospitals and all healthcare providers as well. Just one example, on the physician side, Medicaid pays anesthesiologists $17 per unit. They pay Medicare pays $22 a unit, which would mean that on average, an anesthesiologist working full time would make about $150,000 to $200,000 a year, which is not what they expect. And as a result, they have to get somewhere between $60 and $100 from the per unit from the private payers. And if they don't, then they also have to get a stipend from the hospital, who then has to pay for that stipend. How do they pay it? They try to raise their rates for the employer because there's nothing you can do for Medicare and Medicaid.
Right.
So you have this vicious cycle going on, all caused by Medicare and Medicaid.